Hi, I'm John Havard from Vaccination Health, and we're one of the relatively few practices that's been authorised to give the new COVID vaccination to our own patients from our own premises. But this means we've undertaken to do it at weekends only. Now, the process is much more complicated than the flu clinics that we're so used to, so we thought it'd be useful to make a film to show you exactly what you can expect, but this might yet be subject to change. On Saturday the 16th of January we'll start vaccinating with the Pfizer-BioNTech vaccine, which requires a 15-minute socially distanced wait for observation after the injection. The observation period might not be necessary if we get the Oxford vaccine later, but in the meantime we've planned for patients to enter around the back of the building where we are now and to leave by the usual front door after they waited 50 minutes in the waiting room for this observation. As you'll see when you arrive, we've put up scaffolding along the full length of the back of our building. It's a covered walkway with plastic sheeting on the side to help protect you from the winter elements. You must still wear a mask and stand at least 1 metre apart outside, and we will have markings on the ground to indicate this. Please arrive at your allotted time. If you're too early, you'll not be able to join the queue, and if you're too late, you'll miss your slot. If you can park elsewhere or be dropped off, and that will relieve congestion in the car park. It's best if the person being vaccinated is on their own, assuming they do not require a carer or assistance. When you enter the building, you'll give your details at the first room on the left, room 7. Once your details have been logged, you'll be directed to one of 3 vaccination rooms. In the vaccination room, there will be 2 people, the vaccinator and the administrator. The vaccinator will ask a set of questions to ensure you're suitable for vaccination. There will be a large print laminated sheet available for anyone who's hard of hearing. Once you've consented to receive it, then the vaccinator will give you the injection into your upper arm, usually on the left unless you prefer the right. It's important that you are clear that you want the vaccination before you arrive by reading the information given to you in advance. This will minimise any delays. Please speak to a marshal or member of staff if you have any questions on the day. After pressing on the vaccination site for a minute or so with cotton wool, a sticker will be stuck on your lapel indicating the exact time of your vaccination. You'll be given your vaccination card which details which vaccine you received and when. You'll then be directed to the waiting room where you'll wait for 15 minutes. The waiting room will be managed by 1 or 2 members of staff who are there to ensure your care and safety. You'll be asked to sit in a socially distanced seat and given a leaflet about the vaccination to read while you are waiting, which you can take away with you. Once the 15 minutes are up, you can leave the building by the front door. Our staff will be available to assist you should you need help getting out of your seat in order to leave promptly after 15 minutes. We need to ensure a smooth flow to minimise delays. Please be patient if the process doesn't run like clockwork. We've done our utmost in planning the procedure and we're relying on both staff and volunteers to give up their weekends to ensure we play our full local part in this massive national campaign. We'll be working through the at-risk groups sequentially according to the government-determined priority, but we do not want any wastage since we have just 3 days to deliver over 1,000 vaccines. Please email the surgery on saxmundhamhealth@nhs.net if you are prepared to come down at short notice on the day to prevent any vaccines being wasted. You must be over 50, but not necessarily in the highest risk groups. We must emphasise that this will only be a reserve list for any vaccine left over after the booked clinics, and there's no guarantee. Thank you for your time and for watching the film. We appreciate your patience and support as we take on this rather mammoth task in order to provide you, our patients, with the best protection we have against COVID-19. Thank you.